guys, I just wanted to chat a bit about this particular job. Not long ago I posted this case study where we worked on this tooth. Here it is under the microscope. This is the scan we got, what we did, and our subsequent steps. We turned everything into an STL format and 3D printed this model. Why I like doing this kind of thing is because it allows me to, in the future, monitor the quality of how the crown fits. We do all of this in our clinic. So, for example, yesterday the patient came in to have their tooth prepared. The next day we prepared, printed everything out and milled it down, and now tonight I'll be fixing it in place. What I like about this model is that I can work on the crown by the proximal contacts, create the morphology. Right now the tooth is just this feldspathic ceramic Emax. We shaped it, created a tiny relief. Now I'll be focusing on painting the crown. So we take this model, set it aside, grab a pair of pliers to hold it, and we'll be doing a sort of preliminary pre-application of the color. We take our palette, grab a bit of glaze, just like an artist. We cover the tooth with the glazing compound. Look here, it starts to shine, reveals the morphology. The oven is signaling us to close it. Oops, let's hit stop. Okay, let's continue applying the glaze. Onto the tooth. This is all preliminary at the moment because we'll be dealing with the rest of the parameters after the color is applied. Next, we apply a bit of a brown shade because the ACC color of the tooth is pretty dark. Around the color parameters A1, A2, so we can safely darken the neck of the tooth, and after that, baking, we can have a look. I also like to add a bit of dark blue to the cutting edge, the surface of the cutting edge. It gives a slight effect of transparency to the cutting edge, which is also very interesting. Alright, and we send our restoration to the oven following the parameters epoxy mode. This is an Ivoclar oven made in Germany. All the parameters are preset. Our task is to just place the crown on the tray, and after all this we send it off to bake. I always send them off to bake, pigment baking with correction, 20 minutes later and the crown is ready. If the patient was here, we could get started on fixing the restoration, or we could go ahead in the mouth to choose the final shade of color. But the patient isn't here, so we can easily get this done now. When the patient comes to the clinic, we'll try everything on again and can also set it back into the oven for another 20 minutes to fix the restoration. So fixing the crown will take us about an hour in total, which isn't too long. Come visit our clinic, Mr. Dent. We'll be happy to help.